Thank you for your interest in facial plastic surgery. So if you're considering undergoing facial plastic surgery, this segment will be an introduction for you into the world of facial plastic surgery. So during this introduction, we're going to cover how plastic surgeons look at the face and what you may consider needing either surgery or non-surgical options and how you know which one to go after. Okay, so let's get started here. How do you look at the face? Well, as plastic surgeons, we look at the face by dividing it into thirds. There's the upper third of the face, which is this area. That includes the forehead and the upper eyelids. There's a middle third of the face, which is otherwise known as the mid-face, that basically are the cheeks, the lower eyelids, and the nose. And there's the lower third of the face, which is basically the mouth, the jowls, the jawline, and the cheek hollows. And we do include the neck in some of those procedures. So once again, as plastic surgeons, we divide the face into thirds. There's the upper third, the mid face or middle third, and the lower face or lower third. Now in my office at YPS, we offer the entire spectrum of both surgical and non-surgical treatments. Okay, anything from creams that you can put on your skin to going to the operating room and having surgery. But how do you, as a patient, potential patient, know whether surgery or non-surgical options are going to work for you? Well, put very simply, non-surgical treatments will treat these types of things. If you've got fine or deep wrinkles, non-surgical treatments can improve those. If you've got age spots or blemishes, you don't need surgery, you can treat those with non-surgical treatments. And if you've got facial volume loss or thinning of the face, that also can be treated non-surgically without going to the operating room. Okay? Well, then when is surgery indicated? Well, surgery is indicated primarily if you have sagging or excess skin. Okay? That's a place where the non-surgical treatments just don't work yet. So if you've got sagging skin in the lower face and the neck, if you've got sagging skin, let's say, of your eyelids, if your eyebrows are drooping a lot, then the only real option is surgery, because typically that sagging is due to excess skin, and to get rid of that excess skin, we have to cut it out surgically. The other thing that necessitates surgery is severe puffiness, okay? And the area that people complain most about puffiness are their under eyes. And you can see in that picture up there, the under eyes, if you've got puffiness under the eyes, there's no good non-surgical treatment that's going to permanently get rid of it. That you need to have surgery for. Same thing if you've got puffiness, let's say in the lower face or other parts of the face, then typically that is treated with surgery. So how do you use this online pre-consultation? Well, I have set this online pre-consultation to make it very easy for you to use. Once again, we divide the face into thirds. So the first thing that you want to consider is what is the issue that you're having. And so if you say, well, what I don't like are the wrinkles of my forehead. Well, then we're looking at the upper third of the face. So you want to go to the upper third of the face section and put in that you dislike the wrinkles of your forehead. Look for that on the menu there, and you'll see forehead wrinkles. If, let's say, you dislike your jowls, well, that's the lower third of the face. So you want to go to the section for lower third of the face and look for the segment that is titled jowls, or treating your jowls. I don't like my jowls. And so what you want to do is look at your face and say, okay, what is it that you dislike? What do you want to change? Okay, and if it's in the upper face, go to that section. If it's in the mid face or middle third of the face, go to that section. And if it's in the lower face, then go to that area and look up the issue that you are having or that you want to correct. Hopefully that's pretty simple for you. I designed this online pre-consultation to try to make it very easy for you. There is a ton of information about pretty much every single beauty and aging problem that you can think of in the face, and it's all on this online pre-consultation. Well, thank you for watching this introduction to facial plastic surgery. Go ahead and take that next step and learn a bit more about what you may want to change and improve about yourself.